I did want to welcome you to this DocTalk webinar. It's hosted by the Burnaby Primary Care Networks. We are addressing HPV screening for cervical cancer. Just a couple notes. This is a webinar format. You won't have an opportunity to necessarily talk in the format, but you do have an opportunity all the way through to put questions into the Q&A and or the chat. We'll try to monitor both of them. At the end of the presentation that you'll see, there will be, we hope, time to answer those questions, and we'll do our best we can to answer the questions then. If by chance we don't get to all the questions, we'll make every effort to answer them when we put out the recording to this audience and broader. And just so you know, you will get a copy of the recording, or at least a place where it sits, and it will be made available to everyone who wants to see it on the BurnabyPCN.ca website, as are all the DocTalks that are available. And maybe we can move to the next slide. We do want to acknowledge that the work of the Burnaby Primary Care Network takes place on the unceded traditional and ancestral territories of the Hunamics and the Swahimish speaking people, and we're privileged to be able to work and live and play on their lands. We can go to the next slide. So our presenters today, we're really lucky. We've got some great presenters who are going to walk you through a fairly deep and detailed picture of what this process and what it can mean for you. Dr. Ann Lean is a family physician practicing in Burnaby. She obtained her medical degree from the University of British Columbia following undergraduate studies in biochemistry. She subsequently completed her family medicine residency through the University of Alberta in Edmonton. Prior to starting a practice in Burnaby, she worked in rural Quebec and in the Lower Mainland. And Dr. Jennifer Muir is a gynecologist and I always have trouble with this word, colposcopist, and she's going to tell you how to pronounce that, because certainly I don't. She completed medical school and residency at the UBC, where she is now a clinical instructor in the Department of Obstetrics and Gynecology at UBC. She provides office and ambulatory gynecological care, and she is a certified colposcopist, and I think I'm getting better, provides colposcopy services and treatment through the Abbotsford Regional Hospital and Royal Columbian Hospital. And with that, I will turn it over to our two doctor presenters.
Thanks, Jeff. So these are on next slide. So these are our learning objectives for today's DocTalk webinar. So we'll be discussing, what is human papillomavirus, HPV, and its role in cervical cancer, how to screen for HPV and precancer of the cervix, what are screening tests and why screening is important, what is HPV self-screening and how to get a test, and what to expect after HPV screening. Next slide. So what is HPV? Human papillomavirus, or HPV, is a very common virus. So it's a viral infection that can occur in the cervix, anus, external genitals, penis or vulva, internal genitals, vagina, mouth, or throat. So it's a very old virus dating back centuries. There's over 100 types of HPV, and the ones we're concerned about are the high-risk strains that can cause cancer. So there are many more low-risk types that can cause benign conditions, such as genital warts. But the most common type of cancer HPV causes is cervical cancer. And around 15 of the over 100 types of strains of HPV can cause cervical cancer. So there's no treatment to get rid of the HPV virus itself, but there are treatments for the health issues caused by HPV. So, for example, you can be treated for genital warts. There's also treatments for the cancers caused by HPV if they're caught early enough. And the HPV screening test that we'll talk about, that's used to detect high-risk types that can cause cervical cancer. So next slide. So HPV, it's transmitted through vaginal, oral, and anal sexual contact. So by sexual contact, we mean penetrative sexual contact, for example, penis in vagina intercourse, as well as any sexual activities where there's skin-to-skin contact. So for example, sharing sex toys. So it's common for people who have HPV not to show any symptoms, but these people can still transmit HPV onto others. HPV is actually the most common sexually transmitted infection, or STI. And in fact, 80% of people will have an HPV infection at some point in their life. So anyone can contract HPV regardless of their sex, sexual orientation, or gender identity. And if you get HPV, you will not always have it. In most cases, HPV can go away on its own, just as your immune system can fight off any other viral infection like a common cold. But the problem is if it remains in your body for long enough, it can cause cancer, such as cervical cancer. Next slide. So why do we care about HPV? Of course, we care because HPV can cause cancer of the throat, mouth, anus, and cervix. And almost all, 90% of cervical cancers are caused by prolonged infection with HPV. And the aim of HPV screening is to detect high-risk strains of HPV before cervical cancer develops. So if the screening test is abnormal, people will undergo further testing, which we'll talk about later. So this is important because cervical cancer can cause major health issues, including infertility and potentially death. So next slide. So we can prevent cancers caused by HPV with screening tests and vaccines. So since it's common that people who have HPV, they most of the time do not show any symptoms, it's important to do screening tests regularly to catch these high-risk strains before they develop into cancer. So we'll be talking more about how to get screened later in the presentation. In terms of vaccines, there are also vaccines that can prevent HPV transmission. They're safe and effective, and it's recommended that everyone, so both men and women, people with and without cervixes, get an HPV vaccine. So remember, HPV can cause mouth, throat, penile, and anal cancers, not just cervical cancer. And even if you've been vaccinated, you should still be screened for HPV regularly, since the vaccine protects against most, but not all types of HPV that can cause cervical cancer. And it's important to know that condoms do not guarantee complete protection against HPV, since they can't cover all the skin surfaces around the genitals and anus. Next slide.
Okay, so what are precancerous cells and how do we treat them? Precancerous cells are cells that are on their way to becoming cancer. They're not cancer yet, but without treatment, there's a high risk that cancer will develop. When we look at cervical screening, we grade lesions of the cervix as mild, moderate, or severe. You might hear the terms CIN1, CIN2, or CIN3, or low-grade cells or high-grade changes. The higher the grade, the less likely your immune system is going to reverse these changes, and the more likely that these lesions will progress on to cancer. The low-grade changes are not considered precancerous, and they do not need treatment. Again, the aim of screening is to find and treat these abnormal cells long before cancer develops. So why are we switching from Pap test to screening for HPV? It's because we know that HPV is a better test. HPV screening looks for the virus itself that causes the changes in the cells, while a Pap smear looks for the effect of the virus on the cells once the virus is activated and led to cervical changes. We know it's safe. There was a large study done in British Columbia confirming that HPV screening more reliably picks up precancerous cells than does a Pap test. If you are found to have precancerous cells, we can treat these cells with simple, straightforward daycare setting at an ambulatory clinic. We remove the abnormal cells. We may rarely laser them, or even more rarely have to move on to a hysterectomy to remove the cells, but they are treatable before cancer develops. Okay, next slide. So what are Pap tests? Probably most everyone in the audience here who has a cervix has had a Pap test done in the past. Pap test is done in a clinician's office. We use a speculum to open up the walls of the vagina, have a look at the cervix, take a sample of cells from the cervix, send that off to the lab for assessment. And if your Pap test is negative, you don't need to be screened again for 3 years. We also know that Pap tests are not very reliable. So if you have a single Pap test there's almost a 50% chance that abnormal cells that actually exist are not picked up. That's why we need regular screening every 3 years. In the event that maybe we missed abnormality the first time around, in 3 years we'll check again, or in 3 years we'll check again. And over time, with regular screening, about 7 out of 10 cases of cervical cancer in British Columbia are picked up or are prevented because of pap smear screening. Okay, next slide. What are HPV tests? Well, HPV tests, as we've talked about already, look for the high-risk strains of the human papillomavirus, the strains that can cause cervical cancer. One of the big benefits of HPV testing is that it can be done in the comfort of your own home as a self-collected vaginal swab. This is called self-screening. If you choose to, you can certainly have the test done in the clinic, and there it's either taken from the vagina or the cervix. And the benefit if you get a cervical swab from your family doctor is that a pap test can be run from that same swab, and that's called a co-test. You may have heard of that. Another huge benefit to HPV screening is it only misses about 4% of people who have precancerous cells of the cervix. So unlike the pap test, it misses almost half of the disease. So because the HPV test is very accurate, it misses very few infections, and we can increase the screening interval to 5 years. All right, and then we can have the next slide. And how do we know that a 5-year screening interval is safe? Well, there've been a lot of studies done, and very large studies, to know that a 5-year interval is safe. The probability of having abnormal cervical cells when your HPV result is negative is less than 1%. It's a highly reliable test. And when people in the study were followed out over time, if their HPV test was initially negative, it was at least 7 years between a negative HPV test, picking up HPV, becoming positive, and then getting precancerous cells. So it was a 7-year interval before precancerous cells were seen. So we know that a 5-year interval is safe. There are risks to overscreening. This can lead to a lot of anxiety in patients that have to come back and have more screening. It can lead to overtreatment for people, which can lead to pregnancy risks, such as preterm labor. So we do want to be careful how often we screen. And remember that cervical cancer takes a very long time to develop after an exposure to an HPV virus. So waiting a 5-year interval between screening is absolutely safe. Next slide.
Okay, so at-home HPV self-screening, it means people can use a swab at home to collect a sample themselves. So people who are eligible can get a self-screening kit in the mail and then mail their swab to the lab to perform the test. So you get results in 4 to 6 weeks, and it's free, including prepaid postage. You can still do the test with your healthcare provider if you prefer. And sometimes your healthcare provider may still recommend you get screened in a clinic, so not necessarily do the self-screening kit. So we'll talk about these cases in a moment. And studies have shown that self-screening is just as accurate as screening done by a doctor or nurse practitioner. So there are many studies that compared self-screening and provider-collected screening for HPV, and there were no significant differences in accuracy of the testing, meaning people got the same results either way. Next slide. So for most people, it's much easier to do HPV self-screening at home instead of needing to go to the clinic for a pap test. So, some people prefer to collect their own sample instead of getting it done by a doctor or nurse. It's also easier to access if you don't have a long-term family doctor or nurse practitioner, or if it's difficult to go to your doctor's office. And in fact, since this HPV self-screening started in February, about 30% of the self-screening kits that have been requested have been from people who have never been screened before, so never been able to get a pap. Next slide.
Okay, so who does not need to have cervical screening? You do not need to have any cervical screening of any kind, meaning no pap test, no HPV test, if you have had your cervix removed for a non-precancerous or cancerous condition. So if you've had a hysterectomy done for benign reasons, no history of cancer of the cervix, you do not need to have ongoing screening. If you have never had a cervix, if you were born without a cervix, you do not need to have cervical screening. So if you submit a request for an HPV self-screening kit and you don't need one, you'll be notified by email that you're not eligible and you won't receive the kit. Next slide. Who does need to get screened? You do need to get screened if you have a cervix and if you're age 25 to 69 years old and you've ever had any sexual contact. So we talked before, it doesn't just mean heterosexual intercourse, any contact, genital contact, skin-to-skin contact, sharing sex toys, etc. You should get regular cervical screening. Next slide. So now you know that you should be screened. Are you eligible to do the HPV self-screening test, meaning that you can do this test in the comfort of your own home? So you are eligible for self-screening again if you have a cervix, you're aged 25 to 69, you've had sexual contact, and you are due for screening. So if you're not due for screening, it'll be made known that you don't need to have screening at this time and wait until you're due for screening. Again, if you want to do home screening, you want to make sure that you have no symptoms such as vaginal bleeding, abnormal vaginal discharge, unexplained pelvic pain, pain with intercourse. You'd want to go and see your primary care provider and get seen for those issues. You should also not screen at home if you are pregnant or if using a pessary. A pessary is a device that we use for pelvic organ prolapse. Also, if it's been recommended to you because of your history that you should not screen at home, then you should do the test in a clinic. Next slide. Who should not do self-screening? So this is the same we just talked about in the last slide. If you've had your cervix removed, if you're pregnant, if you're using a pessary, if you're having vaginal symptoms, discharge, bleeding, pain, then you'll want to see your healthcare provider and consider having a pelvic exam and screening taken at the same time. If you have difficulty collecting your own HPV vaginal sample, see your healthcare provider, they can do one for you. And if you prefer to have your HPV collection done in the clinic, by all means, make an appointment and see your healthcare provider. If you're not sure if you should do a self-screen or not, call your healthcare provider and talk with them about what's the best way to have the screening done. Next slide.
Okay, so to get a self-screening kit, you can go to the website, bccancer.bc.ca/screening/cervix, scroll down and click request online. So there you'll enter your name, PHN, birthday, address, email, phone number. If you have one, the name of your family doctor or nurse practitioner in the form, but you don't need a family doctor or nurse practitioner to request the kit. We'll talk about this a bit later. You can also call the number to request an HPV self-screening kit if you prefer that, and then you'll get the kit at your address in a few weeks. Next slide. So in the kit, you'll get a letter explaining the kit, instructions with pictures on how to collect the sample, a swab to collect the sample from your vagina, and a tube and a plastic bag to put it into, a lab requisition form, and a prepaid return envelope to put the swab and the lab requisition to mail to the lab. Next slide. So to do the self-screening at home, you can follow the instructions or you can watch the video online. So it's very easy. You hold the swab at the red line. You insert the swab into your vagina and swirl for 20 seconds. Then you put the swab back into the tube. So the instructions that come with the kit are in English, but the video is available in Mandarin, Cantonese, Punjabi, and French. And then the website has written instructions in many other languages. So you'll write the date that you collected your sample on the tube and the lab requisition form, and then put all of that into the prepaid return envelope and mail it within a week after you collect the sample. And you'll get your results 4 to 6 weeks later by letter in the mail and also online on Health Gateway. So if you're not signed up on Health Gateway, you can go to the link in the QR code on the screen and sign up. Next slide.
Okay, so you've done your HPV test and you have the results, and the test has come back negative. Excellent. So what's the next step? If your HPV is negative, then you do not need to do HPV screening again for 5 years, and you will be notified of this. However, if you start experiencing symptoms such as vaginal bleeding, bleeding between your periods, after intercourse, abnormal vaginal discharge, pain during sexual activity, do make an appointment and see your healthcare provider and consider an exam, even if you're not due for HPV screening. The results will be mailed to you with the address that's on your BC Services card. So do make sure your BC Services card is up to date, and all the information that will come with your results to let you know what to do. You don't need to remember all this information. Next slide. Oh no, your HPV test has come back positive. What does this mean? Well, first of all, take a big breath in, because this does not mean that you have or will have cervical cancer. It does mean that you need further testing. When you get your results in the mail, the results will let you know that you have a high-risk type of HPV, and it will be noted that it's either HPV 16, HPV 18, or HPV other high risk, which is a conglomeration of other high-risk strains of the human papillomavirus. If your test comes back HPV other high risk, you'll be flagged to go in and see your primary care provider and have a pap test performed. And based on the results of that pap test, you will either be sent in for a colposcopy if the pap test is abnormal, or it'll be recommended just to screen for the HPV infection again in 1 year. If your HPV comes back showing that you're high risk 16 or 18, then you will automatically be referred for further testing at a colposcopy clinic. And the colposcopy clinic that you will be attached to will be the closest one to your address on file with MSP. Next slide. Many people wonder when their HPV test comes back positive, do they need to tell their HPV partner that they are carrying one of the high-risk strains of HPV? A couple things to remember here. HPV is a very common infection, and most people will have an HPV infection at some point in their lives. And in the majority of cases, your own immune system will clear out this virus. HPV is not considered a reportable disease to the Center for Disease Control, so you do not need to report this disease. And whether or not you tell your partner that you're carrying one of the high-risk strains of HPV is really up to you. Next slide. So if you are sent for a colposcopy is a procedure done in a special ambulatory clinic, generally in the hospital, where a microscope or a colposcope is used to have a close look at your cervix. Now, the colposcope does not go into your vagina. It stays on the outside of your vagina and magnifies the cervix so we can get a really good look at it. We clean off the cervix, clean away the mucus, and then we put a different stain on. And this stain is taken up differently by HPV infected cells. So we can see areas that may be infected with HPV. And we get a sample of this area, that's called a biopsy. And then we send that off to the laboratory, and that will let us know, do you have precancerous cells that need treatment, or do you not have precancerous cells? Another important thing to know about a colposcopy is that it is not painful. It will feel much like a pap test to you. Next slide.
So what if you don't have a long-term family doctor or nurse practitioner? So you don't need a long-term family doctor or nurse practitioner to request the self-screening HPV test. You'll get your results in the mail and on Health Gateway. But if you do have an abnormal result, you'll need follow-up testing. So if you need follow-up testing like a pap test, then you'll be assigned to a primary care clinic to follow up on these results. So the letter you get will tell you which clinic will contact you for this, and you'll also be told how to contact that clinic. BC Cancer will also remind that clinic to contact you for that follow-up test. Now, if you don't have a regular primary care provider and you're not sure if you should do the self-screening HPV test, or if you need an in-clinic test, you could book a phone call appointment with a walk-in clinic. And then if they do recommend that you get an in-clinic test, then you can book an appointment and have that done at the walk-in clinic. And if you don't have a long-term family doctor or nurse practitioner, you can register on the Provincial Health Connect Registry waitlist. So you can scan the QR code to go to the link to register. Next slide.
Thank you, Dr. Lynn and Dr. Muir. That was great, and there was an awful lot there. In fact, I think you may have answered most of the questions that folks have, but I do want to take an opportunity to give people an opportunity to ask questions as they come up, or even if you heard something but you weren't quite sure and you'd like it clarified, please ask. You can put it in the chat, and we'll make sure we get to it. A couple things that have come up in the past. Talking about transgender people, how does that fit in with this kind of screening? Does it apply to people who are transgender or who are in transition physically?
Absolutely does. So anyone with a cervix, a trans man with a cervix, a non-binary person with a cervix who has had any sexual touch or encounters should have cervical screening performed. And benefit is with the HPV home screening, some people may be more comfortable screening in their own home.
Great. And you talked about prevention, but I mean, is there any clear way of pure prevention, or is it this? I suppose is abstinence the only way of pure prevention?
Yeah, I guess so. I guess abstinence is maybe the only way for pure prevention, but it's hard because it's very common to get HPV through, any skin-to-skin contact.
Yeah.
There are HPV vaccines that can prevent against some strains, but not all strains of HPV.
It seems like it's just another one of those things, like, I mean, it's highly common and can be very dangerous, but often isn't, and is highly transmittable. I mean, it's starting to sound a little COVID-like, in that kind of way, right? But unfortunately, there's no vaccine at this point. Yeah. Just curious, what are the advances that are being made around HPV? Do you know, can you speak to any of the evolving medicine and the evolving treatments?
Well, the benefit of the cervical screening is that we can treat the precancerous cells and almost eradicate cervical cancer. There is an aim in Canada to eradicate cervical cancer within the next decade through HPV vaccinations, trying to get a high vaccination percentage throughout the population. And with the HPV screening, we think that we can eradicate deaths from cervical cancer, which would be really amazing. It is a disease that affects generally younger people with cervixes, often in their 30s, which is obviously you're busy at this time, raising a family, getting your career going, and suddenly you're held up with this very dangerous condition if it's not treated.
Can you give an idea of what the mortality rate around cervical cancer is right now?
It really depends on what stage we pick the cancer up. So if you pick up the early stage cancer, stage 1 or 2, then survival rates are really good. Once the cancer becomes advanced outside of the cervix and starts to metastasize, it's really much, much harder to treat, and survival rates decrease rapidly with that. And the treatment becomes much more onerous rather than a straightforward hysterectomy. You might need chemotherapy, radiation therapy, and then the complications that go along with that.
Ergo, get tested, whether you think you need it or not.
Absolutely.
Yeah, this is the encouragement to do this and take that test. Thank you. I think there's a question that, as there always is in Burnaby. In Burnaby, we have over 130 different languages spoken. Do you know, is this testing? I know that you point to the website. Is it accessible for folks with different languages? And are there any other avenues that people could go to?
Yeah, absolutely. So the website does have written instructions in a lot of languages. So of course, English, French, also Chinese, Punjabi, Tagalog, Korean, Persian, Spanish, Vietnamese, German, Ukrainian, Tigrinya, so a lot of languages. And then on the kit that you get, there is a place like a QR code you can scan to get linked to that area or to help translate.
That's great. And what about other, I mean, I guess that's it. I mean, what, part of the purpose here today is to really get the word out. But there are so many groups that sometimes you spoke to, not having a family doctor. Obviously, I would imagine that family doctors are now, as their patients come in, alerting them to this and suggesting that they follow through with this. But for those who don't have family doctors and who may be more isolated, whether it's from language, from culture, from folks with neurodiverse, are there avenues that sort of that the communication is being made widely available through?
Yeah, absolutely. So for people that don't have a regular primary care provider, I've seen it advertised on bus stops, on social media, Instagram, Facebook. So trying to get the word out.
There's a question about you. You talked about the eligibility, and so there's a question about if I'm a 70-year-old and I'm sexually active, I'm not eligible to get the test, and if maybe it's what's the rationale beyond that, I guess is the question.
Yeah, so the current screening is that if you haven't been screened, if you say you're 70 years old and you haven't been screened ever in British Columbia, or you haven't been screened, say, in the last 5 or 10 years because you missed your last screening at 69 years old, then you should do a screen even if you're 70 years old. So, and if you've never had a HPV screening or any cervical screening in British Columbia, and you're 70 or 71 or 72 years old, then certainly do get screened. We'd like to have you in the system with at least one test.
So that kind of goes.
If it's negative, then at the age of 70, 71, 72, then you wouldn't need further HPV testing.
But that goes to that next question: at what age do you no longer need to do PAP or HPV testing? And I think that you kind of said if you've never had it done, there isn't an age, and if you've had it done, then maybe you've reached that age. Is that right?
That's right. Unless you've been treated for cervical cancer or precancerous cell, or been treated for precancerous cells as well, then you may need ongoing screening past the age of 69, depending on how close you were to the age of 69 when you were treated.
Great. This next one uses an acronym that I do not know, so I will spell it out. Does HPV lead to genital warts even if someone had an LEEP?
Okay, so LEEP is the treatment that we do for precancerous cells of the cervix, loop electrosurgical excisional procedure. So we do LEEPs for precancerous cells of the cervix that are caused by the high-risk strains of HPV. Genital warts is caused by low-risk strains of HPV. So even if you've had a LEEP before, you certainly can still get genital warts because they are caused by different strains of the virus.
Okay. So this one goes to, and I had curiosity around this. This is, you kind of started with, you don't need to tell your partner. There's another piece is there was a wide range of ways that you might get this virus. But the question is, I've had the same partner for more than a decade. We don't have sexual contact with anyone else. Should I still get screened? Can I get HPV from someone else without having sexual contact with them?
Yeah, so certainly, even if you've had the same partner and there's no sexual contact with anyone else for both you and the partner, it's still recommended to get screened. Can you get HPV from anyone else without having sexual contact with them? HPV is usually transmitted with close contact. Certainly, it can be through touch if there's recently handled bodily fluids from someone that is HPV infected. So it's rare, but could still be possible. So I would definitely still get screened.
So I mean, I guess that to me that the counter to that is, why would you not get screened? It sounds to me as if the test itself, and I mean, I'm not in a place where I would get the test, but it sounds to me as if it's not a difficult or onerous test to take. Is there any other reason that somebody wouldn't get tested?
I don't think so, and especially now that we do have the home HPV test, it's super convenient. It's super easy to do. it's free. You just mail it back in, you'll get the results. And hopefully it does give you peace of mind to know that you're at very low risk for cervical cancer. I've had many people through my colposcopy clinic come in and say, but I've had the same partner for 20 years. Like, I don't understand. How could I have an HPV infection? And remember, the HPV infection can live in your cervix and do nothing for decades. So you might have been carrying around this HPV infection from your first sexual encounter, and then you've been happily and monogamously married for the last 40 years. But that HPV can hide and evade your immune system, and then for reasons we don't fully understand, start to replicate, deregulate your cells, and over time lead to precancer that can then become cancer. So it is important if to have regular screening.
Mm-hmm. And I mean, then that kind of goes to the if someone has had a pap smear that's negative, that doesn't preclude getting an HPV, going in getting an HPV test.
So if their pap test was negative, no, absolutely, they can still do an HPV test, and it would be recommended at the time that their next pap smear screening would be due.
They would do it instead, but as opposed to, I'm just kind of clarifying for myself and for folks, if you get an HPV test and you're negative, you don't have to do it for quite a long time. If you get a pap smear, that doesn't mean you shouldn't get an HPV test. It could show something different than the pap smear. Is that right?
Absolutely. So a pap test, as we talked about, looks for the changes that HPV causes. The HPV test looks for the virus itself. British Columbia will be switching everyone over to HPV screening. Right now, the cohort's starting, meaning if you show up for cervical screening, you're 55 or older, you'll automatically have an HPV test done. And as we move people through the system, that age limit will be decreased until everybody will be only getting an HPV test, and then only getting a pap test if your HPV is positive.
So this question comes again. I think you've answered it, but I feel like it's worth reiterating. Someone saying, I've been in a relationship for 29 years. Is the screening and testing necessary even if you've never did the test before? Even if you don't feel anything to concern you, should you be doing this test? I'm going to give you the answer, the opportunity to reinforce this.
Yes, absolutely. And I guess the point of the screening test is to pick up things, before there are any symptoms, before you get any problems for it. So in fact, if you feel perfectly fine, you should that's when you should be getting the screening test.
So this next one's actually about the vaccine. Can you explain the HPV vaccine process looks like? Do you have to get multiple boosters? What if someone gets one vaccine, then doesn't get a booster until years later?
Yeah, so the HPV vaccine, it is 3 doses. And the most common one right now is the Gardasil 9, which protects against 9 strains of HPV, some of which can cause cervical cancer, some of which can cause genital warts. So if you did get one vaccine and then you didn't get a booster until years later, as long as you get the recommended boosters, as long as you get those 3 doses, then, that's what I would recommend. So if you have only had 1 or 2, but you didn't finish the full course, I recommend that you see a healthcare provider and then get the subsequent doses.
So essentially 3 doses, and that's it for a lifetime. You've had your 3 doses, you've had the full course, and then you don't need to get vaccinated again.
Yeah, for the most common HPV vaccine that we have on the market right now. Yes.
Got it.
Yeah.
I'll just jump in and say the HPV vaccine is offered free to all children in school in grade 6, both boys and girls, and they just need 2 doses. It's an expensive vaccine. It's about $200 each injection, and you need 3 injections if you're not a child anymore. So if you get it in adulthood, it is recommended for women up to the age of 45 and for men up to 26. And it's, I believe, if I remember correctly, it's still free for men who have sex with men up to the age of 6 and non-binary and trans people. The HPV vaccine is covered up to the age of 26.
And so they have to ask the question, are there any side effects of the vaccine that you're aware of or that people should be aware of?
The usual side effects from any vaccine, but it's very safe and effective. So, redness, swelling, discomfort from the injection. If you're, in the rare case, allergic to any component, an allergic reaction, but generally people don't have any serious side effects.
Great. This one actually seems like we may have a physician in the audience. If my patient had a pap test done November 23, which showed insufficient sample, repeat pap test in 6 months, should I complete the pap test now or the HPV DNA swab? And I don't know if you need a formal referral to answer this question.
That's a really good question. So again, if you had insufficient cells and they want the pap smear repeated, if your patient is 55 or older, they will automatically have an HPV swab, an HPV test done on that sampling. If they're under the age of 55, then at this point, a pap test would be run on the results again. I have seen under the age already starting to come back under the age of 55 when they get the ASCUS, atypical squamous cells of undetermined significance. And if they've had a few of those in a row, it seems like the lab is already reflexively performing an HPV test on those pap smears.
So that kind of may go to the next question as well. Are there any cases where we should do both a pap test and an HPV DNA swab at the same time?
Currently, everybody going through getting a colposcopy, if they have a treatment like a LEAP, and they come back to colposcopy 6 months later, they will have both an HPV and a pap test done. That's called a co-test. And then if that co-test is negative, they'll go back to screening with their primary care provider. And at a year mark from their LEAP procedure, they'll have another co-test done. So there are indications for doing a co-test, and that will be on the colposcopy finished form that gets sent to the primary care provider. It will be ticked off there if the patient needs a co-test.
So, and this is great. This is moving from talking with docs to talking to docs, but that's good. So there's another one, and this is kind of interesting. I think it's around the preventative piece. How do we prevent virus? There's a question around vitamins or supplements that would boost cervical health and help prevent the virus. Is there anything specifically that people might do in terms of their diet or what they do to, or is this the sort of general health stuff that we do to prevent all viruses?
So in terms of supplements or vitamins for cervical health, not that I'm aware of. I don't know, Dr. Muir, if you've heard of any.
No, the main thing is smoking. We know that smoking decreases your immune system, and smokers are at higher risk of ending up with precancerous cells of the cervix if they have an HPV infection. Their immune system is less likely to clear the disease if they are smokers.
The next question, actually, I asked us to go through some of the stuff that we've already done. I don't think we'll do that because, but I will say for the person who asked, there's in fact, Natalie's put it back in the chat. The information is there that she's given it to you, and as well, you'll be able to access the whole of this recording, including the deck itself, as well as and if you go to the next slide, can we go to the next slide, please? There's a list of great resources that you can access right there. So I would suggest you will get this deck and you'll be able to click on the one within it. But if you wanted to take a picture of that with your phone, and then you would have it so you could use it right away. And now Natalie's also put up, and I'll mention again that this everything will be on the Burnaby PCN.ca website. There's a question here around this is a person's personal experience. I've had several issues with the virus. Didn't know about the vaccine until today. Will it reverse previous issues or just prevent new strains? This virus has made me so ashamed of being with any partner, which is a terrible place to be.
That's a really good question. And I do see a lot, people have a lot of shame about having this virus, and you really have to remember that we are all exposed to this virus, and almost every one of us will have an HPV infection at some point in our lives. It still carries a lot of shame and stigma, and we're trying to change that because it's just such a common virus. It would be unusual to not have an infection. It's much more common, way more common to have an infection with HPV than never to have had an infection with HPV. So that's one of the things we really need to work on is helping people overcome the shame and stigma associated with it. Regarding the vaccine, the vaccine won't get rid of a viral strain that you already have, but it will protect you from other viral strains. So if you have carrying HPV 18, getting vaccinated can still protect you from HPV 16 and other high-risk strains of the virus. So it still may be worthwhile to get vaccinated, even if you already know you have an HPV infection. And especially if you've had treatment with a LEEP or laser, hopefully then we've cleared out the virus, and being vaccinated is highly recommended around the time of treatment to decrease your risk of having precancerous cells develop again.
Great. So this is it kind of goes to a little bit of detail. Is there a reason that pregnant women can't do an HPV test? Is it because it changes the results, or but they can do a pap test?
Probably the reason is that there hasn't been big studies on pregnant people to know how reliable is the test in pregnancy. We probably just don't have the numbers there to let us know how reliable it is.
Right. I'm going to go back to a doctor-to-doctor question. How is the co-test, which we talked about before, done? Do we need to use a swab for HPV testing additionally, or HPV testing can be done from the PAP kit? And do we need to write PAP plus HPV testing as we write out the rec for this?
So no, you don't need to do both the liquid-based cytology and the pap test, or sorry, not the liquid-based cytology and the HPV swab. So the liquid-based cytology will test for both the cytology, and it can also test for HPV. So in terms of, I guess, the specific requisition writing for both tests, if they're over 55, it'll automatically be done. But I guess I'll let Dr. Muir answer what to write specifically on the requisition.
So in all physicians' offices now, they should have the new cervical screening form. And I don't have one here to pull up in front of me, but it does list down the left-hand side is for primary care providers, and on the right-hand side, there's a colposcopy compartment. So the primary care providers have, the reasons for screening: asymptomatic, follow-up of treatment, follow-up of something else. And then it ticks there what you want to have done. So mostly now, it will just be reflexively done at the lab. Under 55, we'll get a pap test. Over 55, we'll get an HPV test. If a co-test is needed, it is helpful if the primary care provider can tick that, if they know the patient has had a LEEP and they have the form saying you should get a co-test. But there is a lot of secondary checking at the colposcopy screening center itself, which has the patient's file there, can bring it up and say, oh, they had a LEEP a year ago, they should be having a co-test. And the screening center will automatically try to catch all of those and perform the necessary test for that patient.
Excellent. Thank you. Well, are there any other questions before we go? How long? There's a question about how long does it take for my screening results to come back? That's always that wonderful thing where you put the stuff in the mail and you go, and you wait and you wait.
There's a bit of a lag right now. About 2 weeks ago, I was told that there were already 19,000 home HPV tests performed and waiting to be analyzed through the lab. So the system's a little overburdened with the home HPV tests going on and all the HPV on 55 and older that are being taken. So the wait results now are about 6 to 7 weeks. But as we get that initial surge through, the results should be back faster than that. Another question here around vaccination. Will my partner get a vaccine protect me from cancer? How can I protect myself if they don't want to get a vaccine?
Yeah, so certainly if your partner gets the vaccine, it will help to protect you. But the most important thing is for you to get the vaccine yourself, so that you're protected. I think, and then getting regular screening for high-risk HPV strains.
Yeah, you can't rely on your partner all the time. Well, that's great. I don't see any other questions. I'll give people a minute or two just to, if there are any other questions. And again, if you come up with questions afterwards, and you'd like to forward them to us, you have the email that came out from the invitation to this. You're certainly welcome to do so, and we'll do our very best to get answers back to you. And there is another question that comes up, and so we've got the time. We'll address it. If I get HPV and it goes away without me noticing it, are there any risks? Have I incurred any other risks to my health? I had it, now it's gone. Is there anything else I need to worry about?
No, if you're exposed to the HP virus and you transiently had an infection, which is super common with this virus, and your immune system kicks it out and you're rescreened and your HPV is negative, it has absolutely no consequence for your future gynecological health or pregnancy risk or risk of cancer in the future.
I'm going to give you a last one here, and maybe we will make it the last one as we're getting to time. But this gives you one more chance to underline the message. I'm 30 years old, and I could use a screening kit. But do you recommend I come to the clinic to do the test instead?
I think, for that, it's your own personal preference. But I think if you do qualify to use the self-screening kit at home, you have no symptoms, you are due, then I would say, just do it at home. It's very simple, very efficient. And if you have any questions, definitely ask your healthcare provider. But part of this also is, it frees up space for, us in the family doctor's offices to see other people with health issues. So if you really think you could do it at home, then I would recommend you just do that.
Great. Well, I think that's great. I think this has been a really great session. Thank you, Dr. Muir and Dr. Lynn. It's been education for me, and I know it has been for others, for everyone who's attended. I will remind, yes, you can see it all on the Burnaby PCN website. I now know how to say colposcopy, which is great for me as well. I want to thank everybody. Please enjoy the sunshine of the rest of the day, and we'll look forward to seeing you all again. Oh, and actually, I will turn it. There's a little bit of an ask from the hosts that you please fill out the online survey that's popped up on your screen. Just take 2 minutes. That will help us out. And note that the host and surveys, we can't vote. Thanks again,
yes,
everybody.
in order for us to keep on these with these DocTalks and share more information out, please stay on for a few minutes to fill out the 7-question poll. We would really appreciate it. Thank you very much, everyone, for attending today. And to echo Jeff, thank you so much, Dr. Muir and Dr. Lynn, to be here with us today.
You're most welcome.
Thank you.
Thanks, everybody. Have a good afternoon.